Hello everyone! It's week 23 already, and just thought I would update you all on my last week. Since week 22 was not super eventful, I don't have a lot of updates. I think I've already mentioned that I have a lot of dizziness and hip pain, but aside from that, things are pretty normal, I'd say, for being this far along. Apparently baby is as big as a papaya this week, which is kind of a neat thing to visualize. I'm going to read Alpha Mom's week 23 pregnancy calendar week by week. So week 23, your baby is a tad bigger than last week. Are you sensing a pattern? Goodness, I never realized how boring this stretch of pregnancy is. What with the close to a pound, just over a pound, 11 inches long, 11 and 2/3 inches long comparisons week after week. So true. The pancreas is kicking into gear sometime around this week, and blood vessels continue to develop in the lungs. Lung development is a big thing right now since babies born around 24 weeks gestation can often survive outside the womb. 23 weeks is pretty questionable, and 24 weeks certainly isn't a peachy keen time to be born or anything. But still, if you're the morbid sort who gets a tiny bit of comfort knowing that your baby has a fighting chance if something terrible were to happen, well, there you go. So that's baby. And then it goes quite into detail about how mom feels this week, but I'll just go into how I feel this week. I'm pretty hungry all the time. There isn't really a time of day where I don't feel like I could eat at least a little bit, which is kind of new because I only get hungry during the peak times of the day, such as lunch and breakfast, and then a little bit in the evening. But I'm more of a breakfast lunch kind of person where I'll kind of pack it in those two meals. But lately it's been pretty much I'm hungry all the time, and I could eat a large meal several times a day. Which I guess means baby's growing and I'm growing, and I definitely am. I feel a lot fuller, I guess, this week, and my lungs are certainly feeling the compression, that's for sure. And then the dizziness that I had mentioned before, I went to see my OB about it at my last prenatal checkup, which was at 20 weeks, and he asked me a few questions about it because dizziness is pretty typical in pregnancy. If you're feeling dizzy from getting up too quickly, or you haven't had enough water and you're quite dehydrated, which I drink a lot of water. I try my best not to get up unexpectedly, but sometimes I do, and I do get a dizzy spell and it goes away quickly. But lately I've been having just a dizziness that comes and goes, and then occasionally I'll feel like I'm about to faint, and I can literally feel my pulse, and my blood pressure feels like it's really low. And so I mentioned that to him, and he's going to send me in for a test where I wear a monitor for a day, and they're going to see if my heart rate is fluctuating. And although the gap between, the 20-week appointment was at the beginning of August, and I don't get to go see the cardio department until the 25th, I think, of August is my appointment. So that's a really large gap to have, but I guess they're really booked up, so we'll have to see. And I'll see how I feel after that, and if it makes a difference. I haven't had too many this week, but there definitely is times where I feel like something's not quite right in that department. So that's definitely been a concern. And then the hip pain, which doesn't help because I have my job is mainly physically moving and adjusting someone in a wheelchair. So my belly's starting to get in the way, and my hip pain is pretty bad, but there's only 2 more solid weeks of work left, so I should be feeling much better after that once I don't have to be doing the work every week. But I still have a 4-year-old who will be 4 next Tuesday, almost 4-year-old, that I run around and chase, and luckily she doesn't like to be carried as much or need to be carried as much as she used to. This year we've really pushed on walking with mommy and daddy, and we don't use the stroller anymore at all. So she's pretty good to walk, but she still likes to run off in crowds, and I have to be on it and grabbing her and making sure that she's safe. And she really likes to cuddle, and I'm finding it difficult to have her on my lap now. My belly's pretty big and it's in the way, and she's like, wait a minute, I don't get to snuggle as much with my mom. I miss it. Now you can kind of tell that she's confused by me needing a little bit more space. She's used to me being a cuddly mom, and I am a cuddly mom. Lately I just really need the space. I don't like to be touched too much, and I feel really badly about that, but I'm just, yeah, my belly is too big. Yeah, other than that, nothing super new. My next appointment is August 31st for about a 26 week, around there, update. Or a checkup, I should say, which I think they're getting pretty similar at this point, where they just kind of check the heartbeat. They ask you if you're feeling okay and what your symptoms are. They kind of measure the height of the uterus. They'll find it and then see if you're on track, making sure baby's good, which so far baby's measuring really good and no concerns there. I always like to hear the heartbeat. It's a nice sound. But other than that, they're not super eventful, so we'll see what happens at that appointment. And yeah, if I drink enough water, I'm finding that I can get through the day without feeling too dizzy, but occasionally I'll still get those things, so I'll have to talk to him about that. But yeah, other than that, not too much, and I'll just give you a quick belly shot. And yeah, if you have any questions for me, by the way, and need to know or want to know anything more about me and my life, I'd be happy to share. I just kind of don't know what to share. It's hard to know what you're interested in, so the feedback is always great. Just let me know what you'd like to know. And I will just show you my belly. So this is me at 23 weeks. Chair's in the way here. Yeah, you can't really tell from the front in this dress. It's quite distracting, but from the side you can certainly tell that I have quite the bump. So yeah, I will just leave it there, and thank you so much for watching, and to all the new subscribers, thanks again. I really appreciate the support. And check out my other videos if you want to catch up on my short experience so far on YouTube. And yeah, just leave a comment, subscribe, like, whatever you want, and I'll see you next week. Bye.